Welcome to Fertility Doc Talk. I'm your host, Dr. Kaajal Abrol. I'm a board-certified obstetrician-gynecologist and fertility physician based in Toronto, Canada. My goal is to educate patients, partners, and the public on fertility and to destigmatize infertility. Through this podcast, I aim to increase knowledge and awareness about reproductive health to empower people to make informed decisions about their own fertility. Welcome, everyone. In this episode, we are going to discuss sperm, one of the key building blocks for pregnancy. Some people may say that sperm and the reproductive organs involved in sperm production and transport are not discussed as much as the ovaries and eggs. So I am going to take this episode to focus on sperm, including sperm production and sperm transport, so you can understand what is normal and where and how problems might arise. Let's start with structure of a sperm. There are three main parts of a sperm: the head, the neck or midpiece, and the tail. A normal sperm head is oval-shaped, similar to a paddle. The head of the sperm contains all of the chromosomes for the sperm. Chromosomes are DNA molecules that hold your genes, all of the genetic information for your body. The correct number of chromosomes in a human embryo are 23 pairs, so a total of 46 chromosomes. One chromosome in each pair comes from the sperm, and one chromosome in each pair comes from the egg. So a chromosomally normal sperm has 23 chromosomes. The head is covered by a cap called an acrosome. This acrosome contains proteins that help a sperm penetrate the outer shell of an egg for fertilization. The neck or midpiece of the sperm contain mitochondria, which are the structures that generate energy for a cell. In this case, they generate energy to allow movement of the sperm's tail. A normal sperm tail is a single, long tail. It is a lot longer than the head of the sperm. The tail of the sperm is responsible for its movement through the reproductive tract to allow the sperm to meet an egg for potential fertilization. Now let's take a moment to review some of the main parts of the reproductive tract involved in sperm production and transport. The testicles are the two organs where sperm are produced. They are surrounded by a pouch of skin called the scrotum. Each testicle leads to a path of tubes or ducts that the sperm will travel through. It starts with the epididymis, leads to the vas deferens, and then to the seminal vesicle and ejaculatory duct. Each ejaculatory duct empties into a single urethra. The urethra is the tube that travels through the penis and releases urine from the bladder outside of the body. It also ejaculates the semen outside of the body. Every day, an individual with testicles will produce millions of sperm. When sperm first develop in the testicles, they are not fully mature. Once they move into the epididymis, the sperm complete maturation and develop the ability to move or swim. And they are stored in the epididymis until ejaculation, at which point they move through the reproductive tract and are released through the urethra. Sperm that are stored in the epididymis for more than about 2 weeks will get broken down and reabsorbed by the body. Sperm maturation takes about 74 days on average, so about 2 to 3 months. At any given moment, there are different batches of sperm at different stages of development in the reproductive tract. There are 3 key hormones needed for sperm production. 1. LH. This hormone comes from the pituitary gland and acts on the testicle to promote testosterone production from the testicles. 2. FSH. This hormone also comes from the pituitary gland and acts on the testicles to promote sperm production. And 3. Testosterone. This hormone is made in the testicles and is responsible, alongside FSH, for sperm production. When assessing for sperm factor fertility issues, a complete and thorough medical and lifestyle history are important, as is testing the actual sperm. For history, some of the important areas to focus on include 1. Injury, infection, or surgery to the groin area, in particular anything that required medical attention or treatment. 2. intercourse, specifically any difficulties with performance like erectile or ejaculation issues. 3. Chronic medical conditions or medications, for example, high blood pressure or diabetes, especially if not well controlled. And 4. Lifestyle factors, including smoking cigarettes, alcohol intake, recreational drug use, exposure to environmental toxins, and exposure to heat, like saunas or hot tubs. For testing, a semen analysis is routinely used to assess sperm. This test looks at 4 main factors. 1. Volume of the ejaculate. 2. Concentration of sperm. 3. Motility of the sperm, which is the ability of the sperm to move. And 4. Morphology of the sperm, which is the size and shape of the sperm. The normal values for each of these factors, according to the World Health Organization in 2021, are at least 1.4 milliliters for volume of the ejaculate, at least 16 million sperm per milliliter for sperm concentration, at least 42% for total sperm motility, and at least 30% for progressive sperm motility, which means sperm moving in the forward direction, and at least 4% for sperm morphology, meaning sperm that is normal in size and shape. These normal values may change slightly every 7 to 10 years or so, but they are generally pretty similar, and these are the most up-to-date values at this time. Abnormalities in sperm parameters may be seen alone, where one value is off, or as a combination of issues. When the concentration is low, it is called oligospermia. When the motility is low, it is called asthenospermia. When the morphology is low, it is called teratospermia. If, for example, all 3 parameters are low, it is called oligoasthenoteratospermia. The causes of sperm factor fertility issues can be divided or categorized in a variety of ways. Let's look a little more closely at one of these ways. This is how I like to break things down to understand the main causes of sperm factor infertility. Issues can be broken down into endocrine or hormonal factors, testicular factors, and reproductive tract factors. Endocrine factors involve the hormone axis between the hypothalamus and pituitary glands in the brain and the testicles. Common hormones involved include GnRH, FSH, and LH, which are all key to sperm production. These hormone issues may be due to production issues, where the hypothalamus or pituitary are producing little to none of the necessary hormones, or due to lesions in the brain, or maybe even caused by medications. Regardless of the underlying cause, there is a deficiency in one of these hormones coming from the brain that are needed to promote sperm production from the testicles. Disorders of the testicles involve failure to produce sperm in adequate amounts, or at all. Various causes may lead to this, including varicoceles, testicular lesions, chemotherapy, and genetic causes like Klinefelter syndrome. Disorders of the reproductive tract include obstructions of the tract, preventing sperm from traveling from the testicles, where it's produced, to the ejaculate. Causes for such obstructions may include hernia repairs, absence of the vas deferens, ejaculatory duct abnormalities, vasectomy, genital tract infections like gonorrhea or chlamydia, and genetic conditions like cystic fibrosis. Erectile dysfunction is another issue that may be playing a role, but it's not an obstruction per se. This is just a small list of the specific causes that can play a role in sperm factor fertility issues. It's not a complete list of all possible causes. Lifestyle factors also play a huge role in sperm factor fertility issues, as they affect sperm quality. This includes factors such as smoking cigarettes, excessive alcohol intake, recreational drug use, and exposure to heat. It is really important to discuss the role of lifestyle factors on sperm quality because these are modifiable, meaning changing the habit can change the quality of the sperm and potentially pregnancy rates. Any amount of cigarette smoking or vaping or recreational drug use is too much when it comes to sperm. Alcohol also impacts sperm quality. No more than a few drinks in a week, with no more than 1 to 2 drinks in a single sitting, would be the maximum recommended, although cutting this out completely would have the best impact. Heat exposure is one that some people are not aware of, in terms of negative impact on sperm quality. Sperm does not like heat, So heat exposure through hot tubs, saunas, prolonged cycling, for example, may impact sperm concentration, motility, and morphology. In terms of treating any sperm abnormalities, ideally you would start by treating any underlying medical issue, if found. As well, working on lifestyle factors, if present, is key. In addition to this, there are specific supplements available that may help repair and improve sperm quality. These are largely vitamins and antioxidants that have been shown to benefit sperm health. We will dive into this in a bit more detail in a later episode. Now I would like to move on to some common questions I hear about sperm, as it will further help to understand sperm-related fertility issues. A question I often hear is, can I take testosterone to help my sperm count if it is low? Or another common one is, can I take testosterone to help my libido? Both are related to taking testosterone, so the answer applies to both of these questions. If pregnancy is the goal, then you should not take testosterone medication or supplementation. Essentially, testosterone will act as a contraceptive. Taking testosterone will suppress your body's production of testosterone and thus suppress sperm production. Sperm production relies on the body's own testosterone, so supplementing it with exogenous or outside testosterone will not help you produce more sperm. And while testosterone supplementation may help with libido, it will inhibit sperm production, so it cannot be used for this issue while you are trying to conceive. Another question is related to age of the individual with sperm. The question I am often asked is, does my age matter? Will it affect my sperm or our chances of getting pregnant? I think this is a really important question to address. There is a lot of discussion about age and its impact on egg quantity and quality, but not a lot around age and its impact on sperm and sperm quality. And the reality is that age does play a role with respect to sperm. Sperm motility and sperm morphology have both been shown to decrease with advancing age. This is seen after age 40 and especially after age 50, which will impact overall pregnancy rates. We don't see it decrease as quickly as egg quality and quantity over age 40, but it does indeed decrease. In addition to changes in sperm parameters, increasing age is also associated with decreased sexual functioning, so issues like erectile dysfunction, which can affect frequency of intercourse and thus chances of pregnancy. Lastly, multiple studies have suggested a relationship between increasing sperm age, specifically over age 50, and certain neurodevelopmental outcomes in children, particularly autism and schizophrenia. The next common question I want to address is this. My partner and I just started trying to conceive. What are some things he can do to improve his sperm now? Looking at and modifying lifestyle factors are an important part of optimizing sperm quality and improving natural pregnancy rates. Some easy steps to increase the chances of producing healthy sperm include eating a healthy diet, which is rich in antioxidants, maintaining a healthy weight because increased BMI is associated with decreased sperm concentration and motility, and getting active with a moderate amount of physical activity every week because this helps to increase antioxidants in the body. Some things to avoid at the same time include smoking, recreational drugs, excessive alcohol, lubricants when you are actively trying to conceive, and heat exposure. These are some simple steps you can take when first trying to conceive for the things you want to avoid and the things you want to focus on. Another lifestyle question I often hear is, my partner wears tight underwear. Is this an issue? Should he switch to boxers? As discussed earlier, too much heat may affect sperm quality and lower the sperm parameters, including concentration, motility, and morphology. So in theory, tight underwear that keeps the testicles close to the body and in a confined space might affect sperm quality. However, the jury is actually out on this, as many experts believe tight clothing, including underwear, does not produce enough of a temperature change to impact the sperm as much as other sources of heat, like hot tubs or saunas. The next question that comes up quite a bit is related to one of the causes of sperm factor fertility issues. I have a varicocele on ultrasound. Do I need to repair it? Varicoceles are enlarged or swollen veins in the scrotum, the sac of skin surrounding the testicles. They may be asymptomatic, found incidentally on ultrasound, but they may also cause pain or a heaviness. If they are large enough, they may be visible and feel like a bag of worms around the testicle. From a fertility perspective, varicoceles may affect the sperm concentration, motility, and morphology. But this doesn't mean that all varicoceles need to be repaired. There are pros and cons to varicocele repair that need to be considered. First, a varicocele repair may improve sperm parameters, but not always. They may stay the same or even worsen in some cases. Second, it may take up to 3 to 6 months to see any improvements in sperm parameters, which is not a short time to wait. Third, even when improvements in sperm parameters are seen, they don't always correlate with similar improvements in pregnancy rates. Given these varying results, it's important to discuss your specific case with your physician so they can take into account all factors that may be playing a role in your fertility challenges when making a recommendation. Not just the presence of a varicocele on ultrasound, but is it visible or palpable on exam? Are there any other factors affecting your fertility, like ovarian reserve or egg quality, or uterine or tubal issues? How old is your partner? And how long have you been trying to conceive? All of these will impact recommendations for or against a varicocele repair. Personally, in my practice, I will also recommend that patients freeze a sample of sperm before a varicocele repair in case the sperm parameters worsen after the procedure. The last question I want to address is on testing sperm. What is a DNA fragmentation test, and do I need to do this test if I'm doing a semen analysis? As discussed, a semen analysis is the standard test to assess sperm. It allows assessment of semen volume, as well as sperm concentration, motility, and morphology. This gives a lot of information about sperm health. Sperm DNA fragmentation is a specialized test for sperm looking for DNA damage among the sperm. Some causes for high DNA fragmentation include heat exposure, smoking, chemotherapy, just to name a few. High DNA fragmentation has been associated with lower fertilization and pregnancy rates. However, at this time, DNA fragmentation is not a routine test used to assess sperm. Some physicians may use a DNA fragmentation test when the semen analysis is abnormal to gather further information on the sperm. However, it is not uncommon to have a normal semen analysis but a high DNA fragmentation, and thus some physicians may do both tests right from the start to gather as much information as possible about the sperm and any issues in sperm health that may be playing a role. So there you have it, all about sperm. What is normal for sperm structure? What is assessed on a semen analysis? And what are some of the causes of sperm factor fertility issues? Remember, age is important for sperm health. Lifestyle factors are also very important for sperm, and they are modifiable. I hope this episode was useful in allowing you to better understand sperm and sperm health and its impact on fertility. That's it for this episode of Fertility Doc Talk. I really hope you enjoyed listening and learning and feel empowered about your reproductive health. If you enjoyed this episode, please remember to subscribe to the podcast and tune in to our next episode.